Good morning, everyone. My name is Amina, Alio, and today we're going to talk about engaging fathers in maternal infant health programs. So thank you for joining us. The objectives are really to look at why we should be engaging fathers. How important is it during the different times of reproductive health? How have other programs engaged fathers? What has worked? What have been the challenges? And what can we learn to apply to our programs? And throughout the session, we'll be talking about how home visitors or community health workers can participate in engaging fathers. So before we begin, we're going to talk about kind of defining what do we mean by engaging fathers. And before that, I'd like to pull up the poll. It's possible. Yep, we can view the poll. Okay, thank you. So I see not everyone has responded, but really, I just wanted to get an idea of where you are so that I can tailor my examples or the discussion around this. So it looks like the main barriers to father engagement, let's see, the program not including fathers in the design, I assume, don't know how to recruit fathers, mothers don't provide information, program doesn't collect information on fathers, and lack of funding, usually that's a higher one, but only 17%. Okay, so do you have a specific curriculum? It looks like, wow, many people do not have a curriculum, although again, this is 11 out of 12. So there might be others of you who have not responded who are using something. Which group of fathers does your program target? No specific group. And those primarily identified by the mom, okay? Do you have a dedicated male coordinator? No, okay. Okay, thank you for sharing that information. It's going to help me, again, in the discussion today. So, what do we mean by engaging fathers? So when we talk about father engagement, in this presentation, I'm referring to biological fathers or the male partner or whoever the woman identified as her romantic partner at the time, whether he's a biological father or not. Or potentially it could be another father figure that the mother identified. So there are two types of engagement. First one is engaging fathers. So we go back. Engaging fathers in maternal and child health in general. So we're talking about their general involvement in reproductive health, pregnancy, infancy, and this would really involve just getting fathers information about various issues and the importance of their role so that they can support the moms and be there for the infant. So this is their behaviors outside of the program. And then we have involvement in program activities, which means getting dads to come to program activities, to participate in whatever your program has designed for them, either specifically for them or for them with their children or for the entire family in general. So both of these are important since we do want fathers involved in maternal child health, both at home and in a program. But we still need to create a way to get information to dads and training for dads. So we'll talk more about this later. So why engage fathers in maternal infant health? I'm not going to spend too many slides on this, but it is important for us to know that there have been many studies that have shown that fathers are important, not just for child development, but also in preconception, conception, pregnancy, during delivery, after delivery, and even in very early infancy. So if we look at studies during the father engagement during childhood or adolescence, you'll find a lot of information on that. A lot of programs that are focused on involving fathers in their children's lives and education, etc. But when it comes to reproductive health, there really isn't too much out there. It's only the past few decades that we've been really paying attention to the impact of the role of fathers in pregnancy and reproductive health in general. But there are some studies. So if we look at before and in between pregnancies, so if fathers are involved in family planning or reproductive life planning, as well as contraception use, they can influence the intendedness of the pregnancy. They can help increase the use of birth control. They can help reduce the risk of sexually transmitted diseases, which are harmful for mothers and for babies during the pregnancy, of course. So fathers can really influence this either positively or negatively. So it's important to understand that they need to be involved early on. As far as before and between pregnancy still, father's physical health, just like the mother's health prior to pregnancy is important, so is the father's physical health and his preconception risk behaviors. So if he spends his life, adult life using alcohol, smoking cigarettes, marijuana, not eating right, and being exposed to different toxins at work or in the environment, for example, all of these behaviors and environmental issues do impact their genes. It impacts the genes that they pass on to their children through the sperm. So, of course, we need to always keep in mind that half of the child's genes come from the father. So father's health before conception, before pregnancy, does impact what they pass on to their kids, just the same as with mothers. So when we look at during pregnancy, fathers can impact maternal stress and well-being, either positively or negatively. So they can actually cause stress if there's domestic violence or if they don't provide any financial support or they don't want the pregnancy and refuse to take responsibility for the pregnancy. Of course, all of these can cause stress for the mother, which impacts the pregnancy outcomes. But fathers have also been found to reduce stress to help the mother really serve as a buffer for maternal stress. They provide emotional and physical support, everything from rubbing their feet to helping with transportation to prenatal care, for example. Encouragement, financial support, all of these help reduce maternal stress. Fathers can also affect maternal behaviors. So by having a supportive partner, they can encourage maternal positive behavior. They can encourage the mother of their child to eat right, to exercise, to not smoke, and encourage them and support them as they go to prenatal care appointments, for example. So all of these have been shown to impact fetal growth, preterm birth, and infant birth weight, whether positively or negatively, depending on the role of the father. So beyond pregnancy, many studies have found that, well, let me just say, the studies that I did find about breastfeeding mentioned that fathers can influence breastfeeding initiation, as well as the duration of breastfeeding of the mother. So this is, of course, with the big push for breastfeeding, we know that this will be important. Fathers can also help with maternal postpartum depression by providing support for them, also looking for the signs and making sure that they get the help they need, helping with the baby during this time as well, etc. And this has been shown to impact infant cognitive and social development, as well as the different diseases or the health of the baby, of the infant in general. and studies that have looked at it throughout the year, the first year of infant's life, have found that it can actually reduce infant mortality if the father positively influences breastfeeding, maternal postpartum depression, and just is involved in general. So the studies that looked at when fathers are not engaged found that birth outcomes are poor among mothers and infants whose father is not engaged. Infant mortality rates are higher, and racial disparities actually get wider as fathers are not involved. So across races and ethnicities, fathers are important, and we can see the difference between fathers, families where the father is involved and where the father is not across all races. But a couple of studies have found that it was much wider when the father was not involved in African American children and mothers' lives. So if we're talking about addressing racial disparities, it's even more important, more so important to make sure that we're involving fathers in maternal infant health programs. So when fathers are not engaged, there have also been studies that found that there's an increased risk for maternal depression, which makes sense considering the stressors that financial stressors, emotional, social stressors that can happen when a mother is pregnant and does not have a partner to support her in the process. There's also been reduced cognitive and social development in the infants when the fathers are not engaged. So the impact is not just for mothers, but also for the infants. And if we were to look at studies that look at childhood and adolescence, we'll see that this is true across the board, that when fathers are not involved, the impact is long-term on the child. So another reason for us to make sure we're involving fathers early on. So we can, if you have any questions about the studies, let me know. I didn't want to spend too much time on that, but just wanted to give you the idea in general that we do know that fathers are important, not just through common sense, but also scientifically as well. So for the rest of the time, I'd like to talk about involving fathers in our programs in maternal infant health. So really looking at the men behind the pregnancies. And I like this t-shirt. And it's a t-shirt that can be used for prizes. If you think about some activities that you may want to do with fathers, this is a popular one among them. And if you want to buy it, it's online. Just Google father t-shirts or something, and it will appear. You have many, many choices. But anyway, someone emailed and asked about where to find it. That's why I'm giving you more information, just in case others are interested. So, looking at the barriers that you mentioned, this is actually what's also out there in the literature. In general, our society sees women as the primary responsible party for reproductive health, for pregnancy, and for babies. Fathers are usually brought in when there's need for financial support for the infant. Once the baby's born, beginning to go to school, daycare, etc., then the fathers are usually called to become involved in their education, in their financial support, etc. But when it comes to pregnancy and babies, it's usually the mothers, the women that are looked at. There are many socioeconomic issues that fathers face that may prevent them from becoming involved in programs that we all need to be aware of. They may not have employment. They might be incarcerated, have multiple children that they have to support, and so on. And many of them that have been interviewed and surveyed have mentioned the feeling of inadequacy as a father. They themselves did not have a positive role model or did not have a father around, and don't feel prepared to really handle pregnancy and a baby. Geographic location, fathers may or may not be present near the mother or the child. They might be incarcerated as well, so not physically able to be engaged. Other barriers, the relationship with mom has been identified as a really important barrier to father's involvement. Relationships are complicated. Sometimes the issues are very sensitive, and that makes it difficult for fathers, but also for programs that serve mothers, but really are trying to get to fathers, because the mother serves as the gatekeeper to the father who the program is trying to engage. So if the mother doesn't want to provide information or does not see the importance of having the father involved, the programs are, it's a barrier for programs trying to reach fathers. So it's important for staff that work with mothers to try to engage fathers and to inform the mothers of the importance of father engagement. Of course, in conversation, it's important for staff to understand why the mother is being reluctant to share information. Is it because of domestic violence? Is it because he's abusive, or some other negative stressor that could be could have a negative impact on her and her pregnancy? If that's the case, then at least the staff would know about it. But if it's purely based on her own issues or feelings towards a father of her child, then the staff can really try to help the mother understand that it's important for the father to be involved for the child's sake and for her own maternal health while she's pregnant. So here, home visitors and community health workers can really be influential in trying to figure out what's going on, and also encourage mothers to involve the fathers. Okay, so additional barriers are the institutions that provide maternal infant health services are obviously focused on women, and fathers are not really expected to be involved in preconception, prenatal, postnatal, interconception, etc. But they're beginning to, maternal infant health programs and funders are beginning to be more interested in involving fathers, but really have not gotten to the point where they're also funding father engagement. So that becomes a problem. There are a lot of policies and laws that reflect the tendency to focus on mother and child rather than the family as a whole. And many of those policies definitely do not favor men. Examples are paternity and assistance to families, paternity leave, child support laws, etc. So many policies. So institutionally, also, we are focused on mothers and infants, but not on the family as a whole, and definitely not on fathers specifically. So other barriers, there are many cultural variation in how we perceive fathers and fatherhood in our communities. There are many myths that exist about African-American fathers, for example, or Latino fathers, or even Native American fathers, or from fathers from poor communities in general. There are many stereotypes and myths. And sometimes mothers and program staff may subconsciously transfer these beliefs in the way they behave, the way they deal with fathers who come to the program or who they're trying to engage in a program. So this really gives men little chance to become honestly engaged. So it's important for us to realize, to identify and realize the perceptions, the biases that we have against fathers who come from poor communities or certain certain ethnicities. If you think about the high rates of incarceration, high rates of single motherhood in many of our communities, the high poverty, we often easily assume that these men are deadbeat dads, that they should be ignored and, focus on the mother and forget the dad because they're not worth it anyway. So, however, we need to remember that just like mothers, fathers from these communities love their children, but they also have their own socioeconomic issues, physical, mental health needs, and many problems that are environmental and social, and many of these are related to lack of opportunities. So it's important to be aware of these and change our thinking. So approaching father engagement, so approaching father engagement without holding these stereotypes. Just remember that fathers in general care about their children. They want to be involved, but many of them do not know how. And many are not involved in their children's lives because of feelings of inadequacies. They don't feel that, they think all they have to offer is money and they don't have money. Therefore, they can't become involved. They have no experience being a father. They don't know what a good father is supposed to be, etc. So it's important to really understand what's going on and change our approach. So there's no perfect program out there on how to on engaging fathers or fatherhood program, which makes sense considering all fathers are not the same, all communities are not the same, ethnicities, etc. But based on what's been written and my own experience in Healthy Start and our fatherhood programs in Healthy Start, I put together a list of 7 general areas or elements that we need to pay attention to if, as a program, we're trying to engage fathers. So first thing is figure out exactly who the program is trying to engage. Is it the father of the infants being served? Is it the partner of the mother, etc.? Making sure the environment is welcoming of father and the staff is ready. Select the outreach strategies that you can use to reach your target population of men. Tailor the message. Women and men are not necessarily the same when it comes to marketing and advertising and messaging. So we need to figure out how to tailor it, not just to men as a gender or sex, but also as as men from different communities have different cultural nuances. Develop or identify activities. What does your program want to do? What types of funding do you have? And if you don't have funding, what partners are around and community resources that you can refer your fathers to or draw from to help your program engage fathers. Finally is assessing how well your program is doing in engaging fathers and what you might want to do to improve it. So I'm going to go through these one by one. So as far as defining the target population, based on the poll earlier, it looks like most of your programs are really use the term father as general and allow the mother to kind of identify who she feels the father of the child is, whether it's a biological father or a partner or another friend or family member. So, but it's important to know who you're trying to engage. So I'm seeing questions. Yes, I am going to go through all of these. When we talk about activities, I'll make sure to give you very specific examples. So, but thanks, and again, feel free to pose questions so that I can get to them. So fathers of the infant served, are you looking specifically at adolescent fathers, incarcerated fathers, or some other population? So the key is to really know who the target fathers are for your program, because they do differ sometimes. Secondly, prepare the environment. So is the environment welcoming of fathers? If you walk into your program, physical environment, office or waiting room, do you have images of fathers? Is it only women and babies? Do you have any pictures of fathers or posters of fathers? Do you have any magazines, that even one magazine that shows that you are actually expecting men to come in? You can have pamphlets about issues fathers may face. So it could be job training material that other programs may have, that you can have just general information about things that fathers would be interested in, pamphlets, flyers, etc. In your program materials, you could include images of fathers. Make sure the fathers are included rather than just the mother and the baby. And actually, a simple thing is having a diaper changing station in the men's restroom is a very interesting and important way of showing men that they're actually expected to change diapers and that they don't have to look for a women's bathroom or a family restroom, because not all places have family restrooms. So I've seen men's restrooms with changing stations, so it's been definitely noted by the men who use them. Secondly is really to make sure that your staff is trained or experienced, but definitely trained. If we can't all afford to get a male coordinator, but we can definitely train our staff. So is the staff experience, are they welcoming of fathers? Are they suspicious of fathers when they come in? Are they reluctant to address fathers? The fathers have different looks in certain communities. I know that many fathers that I've interviewed have told me stories about how they were not welcomed, or the staff looked at them like, they were coming to rob the place, not really to participate. So it's really important that we train our staff. They're all ready to welcome fathers, no matter what they look like, so that they feel welcome and come back for activities. Remembering that this is not just about helping the dads, but we're helping families as a whole, and we're helping children get a good social support from the beginning. So I have another poll for you. Just if you were to rate your program, so how father friendly is your program right now? It's a yes. Is it yes? Very friendly? Is it somewhat friendly, or is not really, or you haven't really thought about it? So if you can do it right now, that would be great, just to give me an idea. So there are ways that are that men can, for staff to welcome men specifically. And really it's about being human. So assuming that when a father comes in, a young father, if you're working with young fathers, someone comes in with their cap backwards and the pants halfway down their hips, that, our automatic assumption of, this guy is a deadbeat dad or whatever, that we kind of check our stereotypes and treat every father as someone who cares about their child, no matter what they look like, no matter how poor they look, or how young they might look as well. So it's really about treating everyone like a human being when they walk into your program. That's, as far as welcoming, that's really the simplest way to put it. Men, the number one complaint of men that I've interviewed is that the staff just doesn't act like they're supposed to be there, like the men are supposed to be there. So welcoming fathers expectantly, like, yes, you're supposed to be here. We want you to be here, and we don't care what you look like. And we know that you care for your child. So that's, and in addition to welcoming, again, the physical environment is something that they kept mentioning in our focus groups as well, that you walk in, the walls are pink, all the posters are women with their babies. So automatically they know that they're not supposed to be there, or they feel like they're not supposed to be there. So the attitude, staff attitude, and the physical environment were the two mentioned by fathers. So I assume that, okay, so most of you think that your program is somewhat father-friendly, or, and probably there's always room for improvement. So here's a list of questions that you can ask about your program. So you can figure out, does your staff, the staff in your program, do they have an understanding of the role of men and the importance of men in children's lives during pregnancy, as infancy, etc.? Do they really understand? And do the fathers believe that there's value to using the program? Is there a male on staff that fathers are able to connect with? So this one, again, is tied to funding very often. So not all programs can afford to have a male on staff. But if there's no male on staff, is there a male volunteer or another father who could be the point man for fathering activities? Are the women trained to work specifically with men? So we talked about welcoming men, but we're going to talk about specifically conducting activities with men in a minute. Is the physical environment welcoming to father? What biases might be influencing your efforts to engage men? And this would vary depending on the community you're in and the fathers that you're trying to engage. Are there resources available that speak to fathers in your community? Do your promotion materials reflect fathers, either in the wording or the images? Have you identified local partners and resources for men so that when they do walk in the door, even though you may not have the funding to address most of their issues, you can refer them to the right people and show them that you've done your research and you can link them to different programs. So this is just a list that you can kind of go through to gauge whether or not your program really is ready to welcome fathers. As far as staff training, ideally, of course, we all want to recruit staff with experience and training and working with fathers, but this is not always possible, again. But we definitely want to hire people who have an understanding of fathers and gender issues in maternal infant health. Again, going back to the whole maternal infant health field being very female focused and understanding the value of men and fathers' role and importance of bringing them in. And also, we all have our own father issues, some of us more than others. So for staff who have had poor experiences with their own fathers or no experience with their own fathers, making sure that we've worked through our own father issues so that we don't bring that onto the men that we work with. So this goes back to the unconscious biases that we have, not just for race, but also for gender issues, and here specifically for fatherhood issues. So really having the staff think about their own father issues and making sure that they don't project it on the fathers that they're trying to work with. And sometimes these issues can be painful, but again, it's part of life and growing is really looking at our problems and working through them and making sure that it doesn't impact our work as well. Ideally, of course, we want to match home visitors, community health workers, the fatherhood coordinator to the population as much as possible, based on gender, age, background, personality, etc. And this is similar to hiring home visitors or training home visitors and CHWs for work with women as well. Of course, ideally, someone who grew up in a similar community would be ideal to reaching out to that community. So all staff should be trained. It's not just a male coordinator or the individual who's going to come in contact with the men who should be trained. Everyone in the program should be trained on working with fathers, with men, at least understanding the importance of making sure that fathers are involved and engaged in the program. Because one person can really ruin it for everyone if they somehow don't understand and happen to be the one that the father's running to during an activity. So it's important for everyone to be on the same page. Health practitioners, what we found is that a lot of physicians, nurses, OBGYNs really don't see the importance of fathers and often don't welcome fathers at prenatal visits, during the delivery, etc. So it's sometimes we actually have to, as program staff, we may actually have to raise awareness among the health practitioners that yes, our program is trying to engage fathers. Yes, we think it's important. We know it's important, and hoping that they will join you in engaging and making sure that fathers are part of the process. As far as specific home visitor community health worker training, I mean, it's the same as everyone. They really should understand the importance of fathers and the involvement of men in general throughout the reproductive life course, whether it's preconception, interconception, or prenatally, etc. And they have the opportunity to come into contact with fathers, perhaps during home visits or during interaction with the women. They can talk about the role of fathers and show respect for the fathers that they come in contact with. Show that the women and the men that they value the role of fathers. The fathers are important for maternal infant health. And as much as possible, include the fathers in the conversation, especially when talking about reproductive health during their visits. And, you know, even having pamphlets on reproductive health for men. The CDC has information on reproductive life plan for men as well. So if you're there to do it with a woman, why not have it also for the man and hand it to him so that they can be on the same page, or at least the men can start thinking about it as well and not put contraception use and pregnancy planning solely on the shoulders of the women. So home visitors, community health workers, very important role as the kind of first contact for many women and men about fatherhood. Here's a list of potential conversation starters with fathers. Again, we have to, providing these because we have to really be more positive. Men have just been put down when it comes to pregnancy, especially if you think about the men in your community. Half of them have been incarcerated in the past. A lot of them do not have jobs or appropriate income. They might have substance abuse issues. So many problems, just like the women also have challenges. So it's important to really be positive with the fathers when the few chances we have to be with them, to meet with them. So stay positive with the conversations, not asking them why they're not there or why they don't do this, but really focusing on positive things. Like, so what have you learned? What has your infant child taught you? When does something really special happen between the two of you? How has this child changed your life? What are you doing to try to make things better for your child? What strategies are you using to raise your child, etc. So it's these are challenging questions, but also are focused on a positive aspect of what they can do or what they have done for their children. So this is not culturally relevant wording. So of course, depending on who you're speaking with, you would have to change the way you're asking the question. But in general, the idea is stay focused on their fatherhood and their infants and their own contribution to the infant development and raising. So as far as staff training, there's a lot, and then there isn't as well. But we're going to talk about some specific curricula out there. There is nothing that I could refer you directly to and say, well, if you do this program, all your staff will be well trained. Unfortunately, this field is still very not well funded, so there hasn't been much in the area of staff training. But there are some websites that we can provide you that have a lot of resources if you're thinking about staff training. Once you're ready, if staff is trained, you know who you're targeting as far as the types of fathers you're targeting. You want to think about what kind of outreach strategies you want to use. So again, the strategies you use would depend on the funding and the staffing that you have, but these are general. In general, you need to be aware of where your fathers are, and when you know your target population, this is much easier. So for fathers, it's important to target fathers specifically. Don't say family in general. If you want fathers to participate in a specific program or a specific activity, you really want to be direct and say fathers, because as soon as people, women and men, see the word family or they see the word parent, they automatically think the mother, not necessarily the father. So don't use the word parent and think that you're referring to both. If you want the fathers there, you actually have to use the word father, or they won't see themselves in any of these. So if you're targeting teen parents, don't call them teen parents. Call them young fathers. They are fathers, they're not children. They might be children by age, but responsibility-wise, they're not fathers. So call them young fathers versus teen fathers. And use a father-friendly hook. Sports team is something that we've used a lot. In fact, most of our fatherhood conferences are all about sports, and every year there's a different theme, whether it's football, basketball, or different sports, but it's usually things that men in general find interesting. So use a father-friendly hook. One strategy that's been used is called the invite dad strategy. And this really is basically direct communication with fathers about the program, either by staff or by the mother. So using staff to invite dads specifically to an activity or a program in general, and involving the mother and having her invite the fathers to participate. So these two methods are part of the invite dad strategy. So once you have an idea of the strategy you want to use, again, for the strategies, if you want to use letters, flyers, etc., it's all about the wording that you use. And another good strategy is to use staff and mothers to reach the fathers. So what message, what should the message look like? Are you using incentives? If you're using the invite dad strategy, making sure that your messaging includes explaining to fathers why it's important for them to be involved in their child's life and discussing how they can make a positive impact on their child. So, you know, it's come to this prenatal child development or fetal development course, learn about your child's development and how you can be a part of making sure your child, your infant, is developing properly while in the womb, and what role you can play. So basically showing them why it's important to attend and what their role might be, so that they can see themselves and not, you know, oh, well, this is just another women's program and I don't need to be there. So the messaging has to be, just like the wording and the strategies, the messaging has to be very much focused on the father, not general, but very specific. So the folks who have written about their programs, their fatherhood programs, many of them have mentioned that using children, the father's children is really the strongest motivator. So if you can explain how a program benefits their child or their infant, that really is a strong motivator for them to participate. Excuse me. Promoting a list. Okay, I have a question here. Is there a list somewhere that has themes that would be helpful outside of sports? Well, there's fishing. So I was part of the, I'm part of the planning committee for the Affirming Fatherhood Conference that happens every year in Tampa, Florida. It's a national conference for people, for male coordinators and people working with men. And honestly, it's all been about sports. They talked about fishing one time, but it's primarily been about sports and fishing. Employment, another one has been using toolbox because men are big on tools in general. And again, not to stereotype, but it is a general fact. So tool, we've used the term toolbox and tools for being a good parent. I've seen driving as another way of engaging fathers. New York State has a booklet. It's a driver's manual for new dads. So they use the concept of driving to explain pregnancy and infant development to fathers. So I don't know of a particular list out there that's been published, but these are the ones that I've seen so far that I can give you. So sports, fishing, tools, construction and tools, and driving has been another one. So I'm sure that there might be others, but those are the ones that I know of. And I'm sorry, there's just not a list out there that I know of. So as far as incentives, programs, again, who have engaged fathers have found that cash incentives can work, or sharing with men that, you know, you will help them, link them to different resources such as jobs or skills building. He might provide childcare or transportation. All of these have worked. The key is really to think about the barriers that might prevent fathers from coming to your program. So if there's a transportation barrier, you want to make sure that they have tokens or bus passes or the money to pay for gas or whatever it is that you can provide. But again, this is very much dependent on the funding source and what your program funder allows as far as incentives. So this is very much dependent on the funding source and not always possible. But at the minimum, if you don't have the funding, you can definitely advertise help finding employment or referrals for different opportunities for men to improve their lives. So as far as the types of activities or programs that you're going to have for the fathers, you need to think about what you want to do, how much money do you have, and what are the resources that you have to actually do what you want to do, and how and when will you conduct these activities. So as far as types of programs of activities, we want to make sure that activities are tailored to the needs of men or fathers in general. And I'll talk about a list of some of these needs in a minute. What's been experienced by many programs is that the issue of spousal relationship and co-parenting keeps coming up over and over again when working with fathers. How do you deal with a mother who is not, who's no longer in a relationship with you and who may not like you because of something you did relationship-wise, but you still want to be involved as a father in the life of the child or in the pregnancy? How do you co-parent when you're not together anymore? So a lot of relationship issues come up when trying to engage fathers. Another issue is really navigating the relationship stresses of parenthood. And this can be done through problem solving, goal setting, and training sessions on conflict resolution for both mothers and fathers. So most of the activities that I've seen working on problem solving, goal setting, conflict resolution, co-parenting, etc., a lot of them have been done with men separately and women separately. So that's actually been shown to work better for couples that are not together than when you put them together with a program that was meant for married couples, for example, or couples living together. So being aware of who the fathers are and making sure that you have activities that are, or trainings that are specifically for single dads or dads who are not in a relationship might be better separately from women. So here's a list of potential curricula for fathers. 24/7 Dad, I see that there's at least one program that is using 24/7 Dad. It's the most popular one. I have to say that it's not, it's really good for training fathers on being involved, responsible, and committed, but it's not really geared towards minority populations, and it's not geared towards populations from poor communities, so, or communities in poverty. So if you use 24/7 Dad, your staff needs to be aware of the need for some potential modifications. If you're targeting men of color, for example, African-American men or Hispanic men. So, but so far that's the most popular, but again, we need to develop something or modify it so that it's more tailored and culturally responsive to minority populations. The father topic booster sessions, these are standalone workshops on different topics, including non-custodial dads, workforce readiness, rights and responsibilities of fathers, visitation, child support, money management, etc. Mom as Gateway is another one because it really helps break down barriers between mothers and fathers and helps and provides strategies for co-parenting. Inside Out Dad is for programs that are really focused on incarcerated fathers and providing them with tools to become involved, more involved and responsible and more committed in the lives of their children. And also increasing the motivation for them to get out and stay out of jail so that they can be better fathers. So if you're targeting incarcerated men, this is a really good curriculum for that. Understanding Dad is an awareness program for moms. Again, moms are the gateway to fathers, so it's important for them to understand the importance of involving fathers in their child's life. And this program does that and also shows them how they can engage the father in their daily lives and in activities with children, with infants, pregnancy, etc. So these are all from educational resources from the National Responsible Fatherhood. So it's fatherhood.gov. You have other, so we have this in the report that we're going to post. The National Fatherhood Initiative is the one that has the 24/7 dad, the father topic booster session, mom is gateway, etc. So that one is fatherhood, National Fatherhood Initiative, www.fatherhood.org. So they have a lot of resources for programs. Unfortunately, some of them you have to pay for. Others are free for use. So I mentioned the driver's manual for new dads. It also exists in Spanish, and that was created in New York State. It's hard to find, but it is out there. I did find the one in English on the internet, and I did provide the website in the report, which will be up quite soon. If you do need these right away, we're happy to send you the websites, but these will be listed as resources in the report on father engagement. So we're happy to send it to you right away. Otherwise, I think it should be up pretty soon. All right. So again, with the curricula, just remember that you may have to tailor this. A lot of these are not necessarily for the communities that we work in, as far as poverty level and ethnic, cultural issues. So as far as how to deliver the programs and activities, we have to recognize that fathers have different needs and interests than women. I know that we are in a post-feminist time and may not always want to admit that there are differences, but culturally, socially, there are different needs and interests that men express that are very different from women's. So recognizing those differences, understanding that fathers, they need to be educated on reproductive health and infant child care, and they need to also understand their role. So whatever program activities you want to have, make sure that that's part of it. We have to cater to men's learning style. Women were fine with getting together and talking, but the men who have been interviewed and who've been in programs are quite clear and direct in saying that active participation and hands-on learning is much better than discussion for them. So if you just invite men and talk, or expect them to talk, they probably won't come back. So some kind of active participation. Don't just talk about how to change a diaper, but actually make them do it. Hands-on learning rather than discussion has been shown to really work. Deliver services. And let me go back to the discussion. So the men interviewed talked about this in general. It's important to have hands-on learning. However, once they started bonding, the men started sharing more with each other as they went on in the programs. So this is primarily initial engagement and making sure that they're learning and they're coming back. And the discussion and the sharing with men happens naturally. And they start off with sports, but it can end up with my baby's mother, blah blah blah, or my child, or the pregnancy this is how I feel about it. So the discussion and the sharing happens, but it takes a lot longer for men to open up, and we can't expect them to do that right away. So we also we should deliver services in an interactive way. So again, this is back to the active participation. Fathers have to feel like they're doing something and not just talking about it. Activities for men, we have to take into consideration working hours, same as with women. So the types of men that you're engaging, if they're young fathers, are they still in school? Are they working? What types of jobs? Are weekends better or evenings? So just like for women, making sure that we have flexible schedules for activities and that we understand what might work best for them. Another thing that men reported is that when they go to programs, especially the ones that are run by females, by women who are working with fathers, is that they're often told what to do or what their goals should be, and how they should be. But we need to remember that we need to let fathers set their own goal and realize that they are experts in their own lives, just like each one of us is an expert in our own lives. So set their own goals of being a father, and then give them the tools to reach those goals, whether it's finding a job or getting their GED or dealing with the relationship with the mother of their baby, for example. Let's see. I think you're talking about the New York State booklet. Yeah, so I do provide a website, and that's I can send it to you. I could not find the Spanish one though, unfortunately. So as far as facilitating the curricula, this is why I like the resources from the National Fatherhood Initiative, because they have training manuals that go along with those. So if you want to use a 24/7 dad, there is a manual for the trainer. And they do have webinars and videos online that you can use for before actually implementing the 24/7 Dad program. So excellent website if you're really thinking about engaging fathers in your program. Very, very, very good. They also provide evaluation tools, so you can have not just the training for the staff, but also the actual curricula and the evaluation forms to use with the father, so to get an idea of how it's going. So, sorry. 6, identifying community partners and resources for men. So engaging fathers is usually an add-on to maternal infant health program. And I think you would all agree with me that the funding is for maternal and child health, and then you're expected to add fathers somewhere in there. Sometimes there's a different line for fathers, budget line. Sometimes there isn't, and programs have to get creative. Because of that, it's very, very important and very effective if you find out what agencies in your community serve men. What types of services, education, training that's out there that you can link the men that you work with to, where resources are out there that you can tap into for fathers you're targeting. So just like for women's services, there's no one program that can really meet all the needs of a family. So it's important to go back to that systems approach that we've talked a lot about this past year. And develop partnerships with other agencies to meet those needs. In Rochester, for example, I don't know if they're on the line, but the Healthy Baby Network partners with Hillside, who has a Parent as Teachers program for parenting education. And that's where their dads can get training on parenting. And I believe they're actually using the 24/7 Dad program right now. So if Rochester's on the line, if you want to say something, feel free to jump in. So providing, again, this is where community health workers, home visitors, program waiting rooms, etc., can provide information on resources for men. So not just here's about your baby, but also we care about you as a person, as a father, and we want to make sure that you have the tools necessary to be the best man, the best father that you can be. So if you need a job, here's some job readiness program. If you need a reentry program because you've been incarcerated and now you have a baby and you're trying to do better, but you can't find a job. Here's a reentry program. If you have issues with the mother, you need paternity testing, etc. So it's really providing referrals for men's services and giving them the information on where to find this. So I've listed the most common needs reported by men. Unemployment is big, and obtaining employment. Child support, the whole issue of child support while incarcerated, child support while you don't have a job, child custody issues. Of course, we know that child custody, the mother is usually favored, but I have met many men who are in our program who had full custody of their child or fighting for it. Paternity testing, reentry program, education, vocational training or skills building, and legal assistance. So these are the primary services that men have specified that they need in particular. So if I were to add my own as someone who's worked in these programs, would be a lot of the issues that they don't mention, which are behavioral. So we're talking about anger management for those struggling with domestic violence as a perpetrator. We're talking about substance abuse programs and programs that help men with substance abuse and any of those behavioral issues that they also need to address, but may not necessarily say it right away. But home visitors and our programs in general can really provide a lot of information on these. And not just showing the men that, you know, we want you to be there for the mothers and the babies, but we also want you to better your life. And that shows that, you know, we care about them as individuals as well, which is important for engagement. There's a question. We have found it challenging to find resources to meet the needs of fathers. Yeah, that's, so it really depends on the community, but finding the resources, it depends on I would really ask the partners and people around the community, because there's got to be someone in a justice, what do you call it? Justice, not justice department, but in the legal field, for example, may know about reentry programs, employment, the unemployment program in your community. They might have a knowledge of specific agencies that help men find jobs, for example. There are some churches I know that work with men to get them ready for interviews, for example. So it's really about networking and looking at your community closely. Unfortunately, there's no one site that you can go and get all the information you need. It's about building partnerships and kind of building that whole system that we've been talking about. And that takes time, and you learn as you go. But I've also found that the few men that you do come across, they may be aware of what's out there in the community, something that they've had in the past that's worked for them. So you can also get information from the men. Another good resource for me has been the faith community. The churches, the Black church especially, the Black church leaders are very much aware of what's going on in their communities, and they might be a good resource for talking about not just their programs, but what other programs are around to help men. So I hope this is helpful, but it's really about networking and talking to people. I'm going to finish this section up, and again, we can talk as much as you want about any of these issues. The importance of assessing how well your program is doing is very important, because all the suggestions that I've given you are based on individual programs talking about or reporting on what's worked for them. They have different communities, they have different the types of men that they're engaging. So it's important to really, once you implement a curriculum or you do an activity, figure out how well it worked, and how good it was at helping fathers understand whatever it is you were trying to teach them, and be ready to change your outreach strategy, your messages, your activities, and all of that, to find out what needs to be done to improve your program. So, and the way to do that is really make sure you obtain baseline information of fathers. So as soon as you get to them, whether it's whatever information you can get from the mom, information you can get from fathers when they walk through your doors, or if you meet them at a home visit, have an intake form for fathers. There are a few out there. I really haven't seen a perfect one. But I know Healthy Start has, there are some Healthy Start programs that have an intake form for fathers. And I'm sure they would be willing to share if contacted. Another one that I found that many people have used is the Brief Risk Overview for Men. So the BRO, a cute name, by the way. So this is a screening tool for psychosocial risk factors that may affect men's health. So any kind of social issues that they have, or psychological problems that may have that need to be addressed. And it also looks at their relationship and their ability to prepare for or fully engage in fatherhood. So this is so far the most comprehensive, that includes both information about the dad, but also about their behaviors and their risk factors, and their general preparation for fatherhood. So if you have this in the beginning, then you kind of know more about your dads, and you know how to tailor your program, and you may also use it to find out how well the fathers are doing in the end. How willing are men to attend support groups? If so, what are some of the support groups that are the most popular? So if you call it support groups, they're not going to come, just FYI. So the support groups that I've seen have been called something else, and I'm blanking out on what we called it in a few of the Healthy Start programs. There's one that we called a Dad Cafe. I don't know. It actually worked. I didn't think it would, because I thought that was more middle classy, but it actually, men did actually come. African-American men was our target. So just calling us something that's not support group or any kind of thing that sounds very mental healthy or more associated with females or talking. I would imagine a beer group would be good, but we don't want to advertise that, of course. We don't want to encourage alcohol use, so that would not work. So like I said, Dad Cafe worked for us. And I'm sure there are other ones. If I think of any more, I'll let you know. But it's really calling us something else, and making sure that it's run by men. That's the number one, the key for male support groups, is making sure it's run by men. If it's run by women, they're not going to come back, or it's going to be more of an education session, not a support group. So that's those two are probably the most important thing for having them come, is how you name it and who runs it. Let's see. Can this form? Yes, so this is, the BRO is actually, it is an intake form. So if you want to, this is the one that I would recommend if you can't find anything else. Or again, you can contact Healthy Start you can contact me here in Rochester, or reach up in Florida, and they will, maybe they'll share their intake form with you. But it's something that they just made up on their own, and we've, so I'm sure they'll be willing to share it with you. calling it a forum, if you want to call, maybe. This sounds, I'm wondering if that sounds more like, what do you call it? Like more academic? I don't know. So what I would suggest, if you want to do a support group, come up with the name and ask a few men around you. I mean, pull them off the street if you want to ask them. But men, if you ask them, they will tell you if it's appropriate or not. I definitely wouldn't consider myself the best judge of the terms appropriate for men. So come up with something or a couple of choices and just randomly ask men around you if they think that would be appropriate. That would be my best suggestion. Okay, no more questions there. Okay, so continuing with assessing, so if you have your intake form, whether you use the BRO or some other form that you can think about making up your own and coming up with the items that you would want to know about your dads before, just when they come in the program. Later on, as fathers are participating in the activities, you want to assess their participation. So are they coming, who's coming, and how satisfied they are with the, oh, that's okay. It's right after the broke. There you go.
Sorry.
No, that's okay. We have two computers going here. So, so you want to assess their satisfaction. Are they learning? Are they happy with the way it's being implemented? Do they have any suggestions for improving it? So all of this is information that's important. Again, these are not evidence-based programs or curricula that you're using. The 24/7 data is not really evidence-based, especially not for minority communities. So again, it's important to always talk to the men, and even informal conversations, have a meeting with them, focus group, bring them cookies and whatever, and talk about how it's going and what they suggest and what their needs are as far as parenting or prenatal care, etc., or their individual health, or have individual conversations. So again, just having those conversations is actually a strategy for engaging fathers, because they see that the program is interested, may not be perfect, but we are interested in making it better and better suited to their needs as fathers. So again, I know we don't always like the word evaluation, but it's really important to see how things are going. And even if it's informal, just making sure that you're in touch of what the fathers are thinking and how things are going for them and how you can change your program. Okay. So I'm going to open up for questions, but I wanted to leave you with the sample checklist. So if you were thinking about how to guide your program and working to reach fathers, so this is a sample checklist that you could use. So you can be strategic. Make sure that you ask fathers about their needs. So did we ask fathers about their needs and interests? Did we do a survey, a focus group? Did we have individual conversation? Or did we use information from a webinar that we heard, which is okay too. But it's important to kind of confirm that with the fathers if you have them around. But sometimes you don't have them around and you have to kind of start out with what you know and later on verify that. Ask mothers about their needs and interests. Do we know who our priority population is? Do we have a name for our dad's program that resonates with father? Again, you may have to do a little bit of asking around. Do we have a list of potential community partners? And hopefully this list grows as your program grows as well. Have we contacted these partners? Have the staff been trained? Have resources, articles, etc., information for staff to read and stay current on the role of fathers? Maybe making sure that at least one person signs up for the newsletters from the National Fatherhood Initiative so that they can stay up to date on what's going on. with the research on fathers. Are the female staff members aware of their role and their influence in the program? Do we have dads-only programs or activities? So it's really key to emphasize to mothers and to fathers that there will be activities specifically for men. I encountered a resistance in one Healthy Start program that kept telling me that the mothers did not want the fathers involved at all in the program. They didn't want us to invite the fathers at all. So after talking to some of the mothers, I realized that they thought that the fathers were being invited to their yoga class or to their own support groups or to their own educational sessions. So of course they don't want the dads there for yoga or for support group. So making sure that it's clear to everyone that there are programs or activities specifically for dads and dads only, not dads and moms, or not the mom programs where we tell fathers that they have to come to the same sessions. So making sure that everyone's clear. Work to better integrate father into existing programs. Again, we don't always have the funding to create an entire separate program, but how can we integrate it into our current activities? Offer activities for fathers and children to share together. Maybe have a Father's Day, some activity for fathers and their babies. Be welcoming. So make sure that you've assessed the father-friendliness of your environment, your physical environment, as well as the attitudinal social environment of the staff. Make sure you have ways to stay in touch with men. This is always a challenge with some of the populations that we work with. So make sure we have as many ways of contacting the men as we can. Provide food, meals, snacks when possible. If not, do what you can with your funding and the appropriation of funds, of course. And seeing whether you can provide transportation for the men when needed. So basically assessing what you have in your program, what you don't have. Making sure that your program is relevant. So you have the resources that speak to fathers, grandfathers, and other men. That you covered the different developmental stages of preconception all the way to infancy. Make sure your resources are practical and hands-on. Make sure you have access to referral services. Hopefully you have a male facilitator. If not, can you have a point person? Is there someone who could provide leadership? Is there someone in the community who could be your volunteer male leader, for example, and that could come once in a while for program activities? Again, I found that faith leaders are often very much willing to do this, or someone from the faith community. So again, I work in the African American community, so most of my examples are about the African American community and the Black church. So give men opportunities to provide leadership in the program. So something that's worked well is to, for men that have been through the 24/7 dad, for example, or whatever curriculum you've decided to use, or have been in the program for a year, a couple of years, is having them as mentors for other men. So mentorship has been something that is really, really key for men, and it has to be mentorship by other men. So again, there's not always funding, but some men are willing to do this on a volunteer basis, to just be volunteers to mentor other fathers or new fathers that come in the program. So during a home visit, should you conduct intake form for the father at the same time as the mother? Honestly, it depends on the situation and how much time and how much focus you need to be on the mother. So if your intake form with the mom is something that you really need to talk with her about, then I would focus on the mom. And if you have the time and are able to, that's really the ideal time to do it, is when you're there. If the father happens to be there while you're there, that is the best time to try to do the intake form. And again, while you're doing the mother's intake form, the father may not be there, but for the next visit, the father may be there. So taking advantage of any opportunity when the dad is there. I just don't want it to, of course, we don't want that to hinge upon or negatively impact the intake form with the mom. So, but yes, I would try to do it whenever I see the father. So I'm basically just wrapping up, and I'll jump to questions as soon as I see one. Overall understanding, fathers do impact maternal and infant well-being. And unfortunately, they're left out of a lot of the preconception, different interconceptional and prenatal stages. But we all expect them to support their children after birth. So researchers found that when the earlier the fathers become involved, the better they are as staying in touch with the children and being involved with the kids as they grow up. So our role in maternal and infant health is really important as far as engaging fathers early on and showing them their importance. The first step really is to make sure that everyone is on the same page. The staff, the mothers, sometimes the mothers actually take convincing, and actually the health providers as well, because you don't want to for all of your staff and all the mothers that you're working with to understand the role of fathers and the importance. And the father goes to a prenatal care session with the mom, and the physician doesn't even look at him, or the physician asks him to leave, or just very negatively respond to the father. So we don't want that to happen, because that can be a barrier to engagement in the future. So making sure that everyone is on the same page is important. Being aware that fathers themselves, just like women, just like all of us, are in need of services that can enable them to really maximize their potential as fathers, as co-parent, and being aware that sometimes fathers are the source of stress. So as a program, how do we deal with that? If a woman is being physically abused or lives with a man who's alcoholic, what do you do as a program? Do you not engage them? Do you not want them in your program because they have these issues? But really, just like mothers have problems with alcoholism or other risky behaviors, fathers that have these issues also need help. And just because they're alcoholics or have a serious problem controlling their anger does not mean that they don't need help or that we don't want to deal with them. So we're doing the mothers and the children a favor by actually helping the fathers address these issues. And this has to be through referrals. And sometimes the best help for someone who's being physically abused is for the father, the perpetrator, to be turned in so they can get help. So whatever the issue is as a program, not to turn fathers away just because they have a problem, but rather to first make sure the woman is safe, but also work with the father separately to make sure that they're getting the help that they need. Because in the long run, everybody benefits from this. So if any additional questions, comments, this is all has been written in the report, and it will be on the website with all the resources and the checklists and all those things that you can use. And hopefully that will be helpful for you as you try to engage fathers in your program. Any additional questions, comments? Rochester, if you're online, if you want to say something about working with Hillside, I'm not sure if they're on.
No, it doesn't look like it.
Or anyone who wants to share about how they're engaging fathers that might help others, that would be great. Okay, I took up a lot of your time, so thanks for listening. And again, feel free to contact me if you have any questions, specific questions, or want additional information about something that I mentioned.
Great, thank you. And I will go ahead and also, when the report is posted on the website, we will send an email out to everybody that was on the webinar with that information, so that most of the information that was in the slides is also, there's some more detail of them in the report that will be posted. One other question was, what are some incentives we can offer or we can offer to males?
Incentives, well, besides cash, what has worked is really showing them that, or somehow telling them that you have some kind of job referral, other resources that will be available to them when they join the program, or something like that. So it's not really an incentive as far as material is concerned, but it's an incentive to become engaged, because we will help you, we will refer you to this program, or we will help you by linking you to this program, which provides job opportunities, etc. So job opportunities has been the best. And again, of course, you don't want to promise a job that you can't give, but you can promise that you have a workshop on job readiness, or that you will have some kind of job fair that they can attend, or you will pay for transportation to go to a job fair, or something like that. So jobs, and of course, always come back to the children, that you'll be a great dad, and you get a T-shirt or something like that. The T-shirts are always cute, and although they can also be expensive, maybe having a raffle sometimes works for either a gift card or a T-shirt or anything like that. Because men are competitive in general. Again, I hate stereotyping, but you can't get around it, because it's our society. So some kind of competition with prizes at the end. Now, what we found is that a lot of community businesses will actually provide the items that you provide for men. So talking to businesses ahead of time that have cups or balls, or I don't know, T-shirts, something that they can provide as prizes for men, or as incentives, has worked for us as well. You'd be surprised how much businesses are willing to give you as far as material. And also tickets to ball games. We've given out tickets to ball games as well. That has been very, very successful, but we can't always do that. So once in a while, someone will provide tickets to a football game or baseball, and we can raffle those out as an incentive for participation.
All right, I think that's all the questions that we've had. So we will go ahead and end this webinar. The next webinar that we have scheduled is next week, and that is going to be on substance use. And we'll be sending a reminder out to register for that if you haven't yet. So we hope that you will join us then as well. Thank you, and have a good day, everyone.